Hello, hi. This patient actually requested me to make a video on post-op expectations. This is her, and this is her post-op. We did her the hourglass tummy tuck. Immediately post-op, you see, medyo bugbog siya. You have bruising. This is actually her incision for the tummy tuck. Yes, it's quite long. Remember, this is just skin and subcutaneous tissue. We did not open her intestines. It's actually her previous belly button location. So when we pulled it down, now we pulled it down over here. In very big cases, wala tayong vertical. Okay? Kasi ibig sabihin, we already removed skin from the belly button down. Okay? In short cases, where there is not enough skin, we always have the vertical. These are her drains. They will stay with her until each bulb has less than 30 cc within 24 hours. When each of the bulb has less than 30 cc within 24 hours, we will pull them out. Okay? This is necessary so that fluids will not accumulate inside. Okay? Magkakaroon tayo ng seroma or hematoma kapag wala ito. This is literally bugbog feels. Okay? Bugbog ang pakiramdam niya. So this is the look of the tummy tuck immediate post-op. The lipo looks like this. Okay? So we have an incision here in the kilikili and the posterior kilikili. Okay? And then this is what I mean by open drainage. Okay? This one with drain is tummy tuck. Lipo only is what you call open drainage. When you say open drainage, see that? We just leave some of the incisions open so that excess fluid, excess blood will actually just leak out. So just let it leak, and that's a lot better for that. The continuation, earlier I actually discussed with you the immediate post-op as it's going to be in drains since it was a tummy tuck. So we're going to be removing the drains, usually within 5 to 7, sometimes 10 days, sometimes 2 weeks, depending on the amount of drainage. And then she's going to be leaking in areas that we actually did the lipo for her. Actually leak more on the dependent areas, which is your elbow. So again, when they stand up by gravity, it just leaks out. It just leaks out. And then it closes on its own. Wait for 24 to 48 hours. When it's actually ready to close, the leaking will actually just stop. After that, she's going to be wrapped up, okay, in compression garments. Okay, we're going to be in garments to compress and shape her body. Okay? The same also goes for men. So now, since it's actually her, she's actually an tummy tuck, she's going to be staying overnight. And tomorrow, she will actually just be standing up and going home. Follow up. Okay, so when they go home, they're going to be antibiotics, they're going to have pain medications, okay, they're going to be in compression. What they actually do, they just change the sponges, okay, because they're actually be using sanitary napkins, literally sanitary napkin. Okay, when it's actually soaked already, you just literally change it. And then until you go to the point that you're actually just on a band-aid. And then that's the time you're actually okay to take a bath. Okay? You're most swollen usually in the first 2 weeks. So it's gonna be big and malaki. So most of the patients will say, Tora, I gained weight. Tora, malaki pa din. So you need to wear your compression garments. Okay? The compression will shrink you, squeeze you out, and actually lessen the swelling and gives you the better shape. Just remember to prevent dent. Nakakaroon sila ng dent sa waist, nakakaroon ng dent sa arm, sa bandang kilikili, nakakalimutan ayusin. Baka mamaya maging permanent. Because this is what we call proper skin redraping. Para maganda yung pinaka post-op results natin. You see 50% of your result on the first month, you lose another 25% on the second month, and another 25% on the third month. Until the best result is actually on the 4th to the 6th month. Even sometimes, even after a year, gumaganda pa din sila. So, matagal talaga. Why is it prolonged? That's just how the body heals. Wound healing is actually a process. Immediately after a few days, bugbog feels, yun ang sabi ko sa inyo, di ba? So, they actually feel very, very sore. Magang-maga, bugbog ang pakiramdam nila. So wherever we did the lipo, that's actually the area that feels actually sore. So bugbog feels aggravated by movement. So when you actually wear your compression, okay, that lessens the sensitivity. Without the compression, it feels like your skin is gonna fall off. During the healing process, it becomes hard and lumpy. Sasabihin sa doktora, bukol-bukol, matigas, no? That's normal. You will be in the lumpy-dumpy stage. You can do some warm compress, okay, especially for the axillary area kapag may matitigas na area dyan. Warm bath or anything that's warm help the healing process. But I would actually advise not to do direct heat. kuha kang hot water bottle, didiretso mo sa tiyan mo. Please don't do that. Okay? Why? Because with the lipo, the skin actually feels numb. Pag hinawakan mo, parang, where is the skin? So, hindi mo maramdaman. So, it's a weird feeling. The skin feels numb, but the insides is actually tender and sensitive. It's because we actually damage nerve endings, kaya siya nagmamanhid na ganyan. Usually on the second month, nagre-recover na talaga yung numbness natin. Best result, 4 to 6 months after. So, wag mainit. Now, a special note on the tummy tuck. Everybody will think, ay, ang laki-laki ng scar, ang haba-haba ng sakay. So, masakit yan siguro. Tummy tuck actually feels numb. Okay? The cut actually feels numb because you actually cut nerve endings. Okay? Ang masakit talaga is actually the lipo part. The lipo feels bugbog. The tummy tuck is numb. Okay, we're going to be removing stitches, usually within 7 to 10 days. A special note, okay, so since for the tummy tuck, we actually stitched up the muscles together to tighten the abdominal wall. Usually in the first 3 to 4 days, tummy actually feels very tight. When you cough, when you sneeze, when you laugh, when you strain, okay, when you make poo-poo, it actually hurts. When the muscles actually contract, it actually hurts a bit. When that happens, all you need to do is hug a pillow to contain that muscle contraction, and it eases out. Today is the first day post-op of our patient. Yesterday, we did actually the hourglass tummy tuck and lipo of the arms and upper back, and also fat transfers to the butt. I will show you the post-op look. Now is the day 1. How they look like when they're leaking, and when actually they have the drains, etc., etc. Okay, so I'll show you that one thing. Okay, this is our patient first day post-op. These are her drains. Okay, they have a lot of drainage, especially this one. It has to be at least less than 30 cc per day for us to pull them out. So she is in compression garments, and wow, look at that waistline. Look at this. Ay, inggit much eh. This is our dressings from her tummy tuck. You have some draining in her belly button. We already removed her IV. For her arm, there you go. We got a lot of bugbog over there, pasa over there. For the swelling, definitely you need to have your compression garments here. You need to wear that, you need to wear this. When she stands up, most of the drainage will go down, the most dependent areas of the body. She's being held up. But that's easy. Post-op bugbog is there. She's going home now? Yes. Ang grabe, ang sexy. Can you try this on? Nahilo ka? Okay, yeah. It's orthostatic hypotension. Okay, that's normal. Kasi maghapon magdamag na nakahiga. Yeah, she's seated up with her granada. She's going to be draining that until kumonti siya. So for the home kit kasi, you're gonna have the sanitary pads. Have your extra arm garment, you have your glove, betadine, your tape, your band-aid, mga extra gauzes na para when you change, no? Ito mga gagamitin nyo. Now, with the sanitary pads, malakas kasi yung draining, no? Because of all the fluids. So, hindi siya kaya ng ordinary gauze. So, we need to use literally sanitary napkin. So, let's try here. Okay? Oops. Okay? See this? Nakita, ma'am? Hindi yung regla. Okay. So, this is actually from here because it'll actually catch the draining. It's actually halos tuyo ka na. Oh, you're actually closing up. Ayan na yung butas niya. Yeah, it's actually almost closed now within 24 hours. As I said, it's gonna close within 24 hours. 24 to 48 hours. So, babalik na lang natin yan dyan. So, the same goes for the other parts of the body that we did lipo. Okay, in her case kasi, tummy tuck siya, so she has a drain. But if it's just regular lipo, napkin lang tayo. Okay. See her bulb? Kanina hindi siya masyadong puno. Now, when she stood up, okay, bigla siyang nagpuno. Even the other one, kanina konti lang. Diba? So, this is what I mean by gravity, no? By gravity, when you stand up, the fluids go down. Kaya mapupuno. So, now we're gonna be emptying the bulb. So, what you do, you release the cap. Yan. Okay? You clamp this one. Okay? And then you drain. Drain everything. Dami, grabe. Ano ba yun? Okay? So, what you do after, you squeeze, create a negative pressure, you close. Okay? And then, there you go. It's gonna drain again. The drains, you should monitor from 8 a.m. to 8 a.m. the next day.
What's normal na usual?
The time for us to remove is less than 30 cc in 24 hours. Kapag hindi siya pantay, mauna yung isa.
And then the other one.